Hepatitis is a serious health problem in many countries. The majority of people living with hepatitis B in Australia were born overseas.
Hepatitis is inflammation of the liver.
The liver is a large organ located on the upper right side of the abdomen. The liver is very important because it filters everything you eat, drink, and breathe. Hepatitis B is a type of virus. A virus is the smallest type of germ that makes you sick.
Hepatitis B is transmitted from someone who has the virus to another person through blood or sexual fluids such as semen and vagina fluids.
Most adults who are infected with hepatitis B recover completely and then become immune to the infection. This means you cannot get it again. In contrast, most babies who are infected with hepatitis B go on to have it for life. If a person has it for life, we call it chronic. Whether or not a person develops chronic hepatitis B depends on age, health, and gender. Males are more likely to develop hepatitis B. Chronic hepatitis B is a major cause of liver cancer and scarring of the liver.
But there are ways that hepatitis B can be prevented and treated.
There are different types of hepatitis virus, and they differ in the ways that they are transmitted.
Hepatitis B is different to hepatitis A and hepatitis C.
Hepatitis A is spread by food or water that is contaminated with feces. Fortunately, that infection is short-lived. Hepatitis B and hepatitis C are both transmitted by blood-to-blood contact.
Hepatitis B can also be present in sexual fluids in both men and women.
In Asian countries, most people have acquired hepatitis B from their mothers at birth if she has hepatitis B, or from not using a condom when having sex with someone who has hepatitis B, or in early childhood from contact with blood from the uncovered cuts, sores, or scratches of someone who has hepatitis B. A person may have acquired hepatitis B from blood present on unsterile equipment that was used for medical injections, tattoos, acupuncture, to pierce ears, or to inject drugs. We say the equipment is unsterile because placing equipment such as needles into boiling water does not sterilise it. Hepatitis B is also transmitted amongst family and household members who use the same toothbrush and razors. Hepatitis B can be prevented through a safe and effective vaccination.
The hepatitis B vaccine is so effective in preventing the hepatitis B virus and liver cancer that it is known as the first anti-cancer vaccine.
If your blood test says you have never had hepatitis B, getting vaccinated will stop you from ever getting it. People who travel to countries where there is a lot of hepatitis B are encouraged to be tested and be vaccinated if they have not been infected with hepatitis B. The vaccination process involves 3 injections over a period of 3 to 6 months. You can get hepatitis B vaccinations from your family doctor, but there may be a charge for the consultation and vaccination. If one member of a household has chronic hepatitis B, it is important that other people in the household be tested and get vaccinated if they have not been infected with hepatitis B. In this circumstance, the vaccine will be free of charge. A woman can have the vaccination if she is pregnant. With permission of the parents, all babies born in Australia are vaccinated against hepatitis B.
You and your family may not have been screened for hepatitis B before migrating to Australia. While you may have had a visa medical test, it usually doesn't include a test for hepatitis B.
Those immigrating to Western Australia under the humanitarian program are offered a medical test after arrival in Australia at the Humanitarian Entrant Health Service, or what used to be called the Migrant Health Unit. Those people who are tested will be advised if they have hepatitis B, and if not infected, may have already been vaccinated. The test for hepatitis B involves a simple blood test. Testing for hepatitis B is available through your family doctor. The cost of the blood test is free of charge through Medicare, but there may be a charge for the consultation with your doctor.
Okay, or do you want me to read it out again?
A woman who has chronic hepatitis B and who becomes pregnant while living in Australia should have any of her children born overseas tested. Some people mistakenly think that because they are family and share the same blood, then they can share personal care items such as toothbrushes and razors.
If a person has a chronic hepatitis B, it is important that they prevent the transmission of hepatitis B to other people.
Do not share personal care items that may have visible or invisible blood on them. For example, do not let other people use your toothbrush, razor, or nail clippers. Use a condom and lubricant when having sex. Avoid sharing any drug-injecting equipment. Insist on sterile equipment for tattooing, ear piercing, and acupuncture.
If you have hepatitis B, it is advisable that you do not donate blood, as you may transfer the virus.
The blood rule is a rule that is used when playing sports to prevent the spread of hepatitis B and C. The blood rule is that a player who receives an open wound, is bleeding, or who has blood on them or their clothes must immediately leave the playing area to receive medical attention. They cannot go back and play again until the wound is cleaned and covered, the bleeding has stopped, and all blood-stained equipment and clothing has been replaced. You will not be infected through casual contact, such as sharing food, drinks, cups, plates, and utensils with family and friends. You cannot get hepatitis B from the bodily fluids in tears, urine, feces, sneezes, and coughs. You cannot get hepatitis B from water, hugs, mosquitoes, toilet seats, swimming pools, and shaking hands. You cannot get hepatitis from a person with hepatitis B whose underwear has been washed with your clothes in the same load of washing. It is rare for hepatitis B to be transmitted by breastfeeding. If you know you have chronic hepatitis B, visit your family doctor regularly to monitor the health of your liver. The cost of most of the tests to monitor your liver are covered by Medicare, but you may have to pay for the consultation with your doctor.
Do not delay your checks at the doctor for the reason that you have no symptoms.
People who have hepatitis may look and feel healthy and have no symptoms. Babies in particular rarely develop the symptoms of the infection. Your liver might be very slowly damaged and you won't know about it. That is why hepatitis B is called a silent infection.
There is no cure for hepatitis B, but there is a treatment that slows down the virus and stops further damage to the liver.
Not everyone needs treatment. Depending on what the virus is doing, your doctor may or may not recommend treatment. However, if there is liver damage, your doctor may refer you to a liver specialist for treatment.
Get tested and get monitored. Hepatitis B can be treated if detected early.
If you have hepatitis B, you only have to tell your employer when you're working in certain jobs. If there is a possibility that another person in your household or a sexual partner has contracted hepatitis from you, it is important to tell that person so that they can go and get tested. We recommend that you tell any medical professionals, including dentists, who come into contact with your blood. In Australia, it is against the law to treat people unfairly because he or she has or is thought to have hepatitis B. If you have chronic hepatitis B, you should stay as healthy as possible. Drink only a little or no alcohol. Eat a diet that is low in fat. Drink plenty of water. Take regular exercise. Lose weight if you are overweight.
Some herbal and traditional medicines can be harmful to your liver. Speak to your doctor about using these medicines if you have hepatitis.
If you do have symptoms of the infection, they might be one or more of the following: abdominal pains, nausea and vomiting, feeling weak or tired, loss of appetite leading to weight loss, general aches and pains, fever. These may be followed by the skin and or whites of the eyes start to look yellow, dark coloured urine and or pale coloured feces. The treatments for hepatitis B come in the form of oral tablets taken once a day or as a weekly injection.
The duration of the treatment depends on the type of treatment and how a person responds to the treatment. The treatment can be very effective, but it may have to be lifelong.
Women who are pregnant can have only some types of treatment for hepatitis B. The side effects of treatment can include tiredness and headaches. If you want to talk with someone about whether to have the treatment, HepatitisWA can provide information and support. If you do not have the treatment, it can cause serious liver disease and cancer. For every 10 people who develop chronic hepatitis B, 2 or 3 are at risk of serious liver disease. Hepatitis B is family business. You can prevent the transmission of hepatitis B through a vaccination and through early detection. If you are living with lifelong hepatitis B, make sure you have regular checkups and live healthily.
Be healthy!
If you need more information and support about hepatitis B, contact HepatitisWA.